Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Welcome back to In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about what you need to know as you manage your practice through COVID-19. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, glad to be back with you.
Hi, Allison. It's good to be back again. We keep learning more as we go through the COVID-19 pandemic. And I look back about some of our previous sterilization room episodes, and we've covered a lot of infection control topics and drilled down deep in our limited amount of time with it. It's almost like a workbook on infection prevention.
Yeah, definitely, definitely. Well, today we're going to be talking about something very timely because you've been hearing some interesting news about another infection control shortage hitting orthodontic practices with states reopening, specifically disinfectant wipes. What have you been hearing?
Well, Allison, I've had several calls, first from orthodontic practices that I do consulting with, and it's like a desperate call. We're out of wipes. What do we do? I called our distributor and we can't get any for the next 2 to 3 weeks.
Hmm.
And as you know, in between each patient, they use a disinfectant wipe to first wipe and clean the surface, and
Hmm.
then wipe it a second time to leave it wet with disinfectant to kill all of the microorganisms, the
Right.
bacteria, fungus, and virus, not just the SARS-CoV-2
Hmm. Hmm.
virus with it. And everyone's been especially conscientious with their disinfecting and cleaning as they reopen their offices. Many of them have gone in and done what they call a deep cleaning prior
Right.
to reopening and scheduling patients. And
Hmm.
so they've been using a lot of wipes. And what's happened, I talked to several distributors and a manufacturer prior to our call today, to this video interview, and said, what's up with the disinfectant wipe shortage?
Hmm.
And each one of them said, Jackie, the manufacturers are manufacturing at a high level. There isn't any shortage of the fabric or the containers or the chemical for disinfectants. What has happened is that there has been a surge supply demand.
Yeah.
When New York and California, two of the most populous states, reopened, in
Hmm.
addition to the other 48 states that were reopening, it created that surge demand. And many of the distributors had not replenished disinfectant in their warehouses.
Hmm.
They had their existing inventory, but because dental offices weren't seeing patients, they weren't buying more inventory. And disinfectants are time sensitive. They have a
Right.
shelf life on them. So they didn't want to overstock their shelves,
Mm.
obviously, because
Yeah.
it could expire and they could be stuck with expired inventory on their shelves. And then suddenly, when 50 states reopened within 3 to 4 weeks, the demand was huge, similar to the toilet paper crisis. And so
Yeah.
all of the warehouse shelves were emptied. The trucks are running and they're getting resupplied. But right now, there is a shortage of disinfectant wipes. And it's scary for the team. They go, oh my gosh, how are we going to clean and disinfect
Hmm.
our orthodontic unit, our orthodontic chair, all of these surfaces that we normally use a surface disinfectant for? And as they start looking at alternatives, then they have questions about the different brands that are out there and how effective are they and how do they use them.
Yeah. Well, so if your wipe is no longer available or the disinfectant you use is no longer available, what are your options then?
Well, if you've been using one brand, say you've been using Optum One as
Hmm.
your disinfectant, what I'm recommending to my clients, if they can't get the wipes, then ask the manufacturer, can you get us a gallon of the liquid
Mm.
and stay with the same chemistry?
Okay.
There are really only 5 chemicals used in all of the disinfectants that we use in healthcare. There
All
are
right.
only 5 chemicals really used in all of the disinfectants that are distributed and sold in both medical and dental. And those are phenols, chlorines, iodophores, quaternary ammonias, and accelerated hydrogen peroxides. Each of them has advantages and disadvantages. And the user has to know how to use them effectively to achieve their goal of killing all the microorganisms with it.
Mm,
Now, the phenols are ones that have sort of that medicine-y smell to them, and we've
okay.
used those a lot in the dental profession because they're stable. You
Mm,
mix them and they're good for, a month, 2 months, 3 months, or they come already pre-mixed and with the wipes. So they're very stable and sort of that medicine-y smell. We've come to equate it with, hey, this is effective against all of the microorganisms. However, the phenols have limitations. They're based on an oil-based product, and they'll build up on the surfaces when you're using them. So you'll get that chemical residue with it, and they're not as effective against non-envelope viruses. And a
mm,
lot of the emerging infections are by non-envelope viruses, such as the norovirus.
okay.
Phenols are not effective against that. However, it is effective against the envelope viruses, where the coronavirus category comes into.
Okay.
The next is chlorines, and I'm going to lump in there iodophores together
Mhm.
because chlorines and iodophores are sensitive to light and to mixing. You can't mix them with hard water. If you buy the concentrate and you mix it, that can inactivate them. And so they really need to be mixed fresh every day, every
Oh,
24 hours. So
okay.
that's a little bit of aggravation. We like to come in to the orthodontic office in the morning, have everything all prepped and be able to see patients and not
Mhm.
have to do a lot of that maintenance and mixing. We want to be all set up, ready to welcome our patients into the orthodontic practice. So that's a limitation for the chlorines and iodophores. Plus, chlorines, bleach, it can cause plastics to get dry and brittle, and the
Mhm.
vinyl, especially on the patient chair, that's expensive, and
Right.
it can cause it to crack over time, and it can bleach out if you accidentally get it on a fabric or on a surface. It
Right.
can cause them to
Mhm.
bleach out. Iodophores, on the other hand, can stain. They have that yellow tinge or that orange tinge to them,
Okay.
so they can stain with it. And then the other product is the quaternary ammonias. Now, quaternary ammonias is really considered a low-level disinfectant. In the categories of disinfectants, there are low-level disinfectants, intermediate level disinfectants, and high-level disinfectants.
Mhm.
Low-level disinfectants don't necessarily kill microorganisms if there's a protein such as blood present.
Mm.
So that's why we really go to the intermediate level disinfectants. We don't have a lot of blood in the orthodontic practice, but
Right.
sometimes we'll have that patient that doesn't have good oral hygiene. There's more blood present, and
Mhm.
saliva has a certain protein content
Mhm.
to it too.
Okay.
So that can mask those low level disinfectants and keep them from being as effective, if you will. So
Okay.
I've always recommended to my clients to purchase one disinfectant, one chemical, and use it both where they need sprays, say in the laboratory, to disinfect an impression or to
Mhm.
disinfect any item that they're taking into there, and then use the wipes on the surfaces in the office. So an intermediate level is really important, and that's one of the limitations of the quaternary ammonia. Many of the quaternary ammonia products have had alcohol added to them to increase their efficacy.
Oh, okay.
However, that causes another problem when you get that alcohol added, because alcohol is not a cleaner.
Mm.
Alcohol is really a desiccant. You need a cleaner in there to remove any of the splatters and splashes, because if the surface isn't clean, we
Mhm.
can't disinfect or sterilize it. So
Oh.
that's been one of the limitations of those quaternary ammonias. They're really considered low level. However, many of the manufacturers have added the alcohol. Now, the alcohol is great at increasing the efficacy, reduces the cleaning of it, and then often, because it evaporates so quickly, it doesn't allow the product to stay wet for the contact time.
Mm.
That's the other important consideration. We all want fast, quick. How quick can we kill all of these germs?
Right.
And it's anywhere, the contact time on different products can vary anywhere from 10 minutes to 1 minute.
Mm.
The CDC's already offered as a challenge of leaving that aerosol generating procedure room empty for 15 minutes before we start cleaning it and disinfecting it. So
Right.
we're trying to move as efficiently as we can in the orthodontic practice. So we want a quick kill time. Ideally, we'd like to get in that 1 minute time frame. Many of the products are, again, up to 10 minutes, but 3 to 5 minutes for all of those products. And then the fifth category of disinfectant is the most recently approved by EPA, and
Hmm.
it's the accelerated hydrogen peroxides. And I'm a
Okay.
huge advocate of the accelerated hydrogen peroxides. They were first introduced internationally in Canada. And so when I was speaking in Canada, I was able to do my due diligence and investigate it and research how effective is this disinfectant. And it is an awesome cleaner.
Hmm.
That's one of the big advantages. It is effective against a lot of the emerging viruses, non-envelope viruses. It's an effective cleaner, and it doesn't contain any alcohol, so it stays wet for that entire contact time.
Okay.
So again, I'm a huge advocate of those accelerated hydrogen peroxides. And as many offices have investigated the disinfectant that we're using, and I know I've even done one demonstration of where I'll have a ceramic tile and
Hmm.
have drops of blood or blood smeared on it and
Yeah.
show the difference in how easily that is removed. That blood is removed with an accelerated hydrogen peroxide disinfectant, and how difficult it is to remove with an alcohol containing disinfectant. And of
Ah.
course, whenever you do a demonstration like that, it proves to you, this is the disinfectant I want to use, the one that really cleans and kills all the microorganisms.
Right.
So it's important to know what the chemistry is.
Hmm.
And then if you run out of wipes, if you're looking at that container and, oh, the manufacturer can't supply any more of these, we're out, then I'd suggest let's stay with the same chemistry. Can you order the gallon containers and maybe make your own wipes with it?
Okay.
So we're looking at alternative solutions now for the during this disinfectant crisis
Hmm.
shortage. We've had the shortage of PPE,
Right.
shortage of N95 respirators,
Yeah.
shortage of gowns. Now we have a shortage of disinfectant wipes.
Right.
Yeah.
So what if you can't get that gallon container, and you can't stay with something that is the same chemistry? What do you do then?
Well, then you're going to have to change. You're going to have to use a different brand. So you
Mm-hmm.
may have been using an accelerated hydrogen peroxide and you
Mm-hmm.
can't get that now. And so what is available is a phenol based. Well, the
Okay.
first thing you're going to do is download the safety data sheet. That's going to any of the products that the distributors offer to you, ask them for the safety data sheet, or you can go to EPA and download that sheet with it. Go to the, excuse me, not EPA, go to the manufacturer and they'll have their SDS sheet.
Okay.
On that safety data sheet, it will tell you what is the active ingredient in it, what's
Mhm.
the wet contact time, what PPE do you need when you use that, and then it will give you the EPA registration number. That number will allow you to go to the EPA's in disinfectant list, which is healthcare disinfectants that are effective against emerging novel new diseases,
Right.
coronavirus. And so
Hmm.
you can use that number, they're listed by numbers, to find the new disinfectant that you're investigating, and it will tell you, yes, it's effective against the coronavirus, and what is the wet contact time.
Hmm.
So good basic information. Now, the next thing that you're going to be looking at is, hey, I've got this liquid now. Maybe I couldn't get the white, but I could get this liquid available. How am I going to use it? And
Right.
many offices say, okay, can I get a spray bottle and put a label on it and do a spray with it?
Hmm.
And that has its own risk for health of the people that are using it. 20 years ago, when standard precautions were introduced by CDC, the ADA recommended a spray, wipe,
Hmm.
spray technique for disinfecting. And the
Okay.
reason was you wanted to spray the surface and then wipe it to clean it and then spray it again to leave it wet with disinfectant. Well, the
Hmm.
spraying produced a lot of aerosols. And
Uh,
if you're breathing those aerosols, then you run a chemical hazard risk of toxicity from them. So that was revised to a wipe technique, using one wipe to go through and wipe the surface and clean it. And then
okay.
you'll discard that and use the second wipe to wipe the surface and leave it wet with the disinfectant for that important contact time, the
Mm,
time that it takes to kill all microorganisms.
right.
So, if they're going to the liquid, then they don't want to put it in a spray bottle, and they may want to put it in a container like this and use 4x4 gauze squares. So in
Okay.
essence, they'd be making their own wipes.
Hmm.
This is not a normal recommendation, and you can't mix up enough of these and put them in the container for a week's supply,
Hmm.
because some of the chemicals that are in these 4x4s, or even exposure to sunlight, could
Yeah.
inactivate that disinfectant. So it's
Okay.
best if you can put it in a light proof container and only mix enough of them for one day.
Okay.
The other alternative would be maybe put your disinfectant in a squeeze bottle, or if you really want to use a spray bottle, then the technique would be to spray the absorbent material, a towel, a paper towel, or a 4x4 gauze square, and then use that to wipe. Again, you don't want to be spraying in the air and breathing all of those.
Hmm.
Now, there's a temptation to look at maybe some other products such as bleach. We all
Right.
know bleach is an effective um, disinfectant. We use it at home.
Yeah.
However, using bleach is a huge risk in the orthodontic practice because it can dry out those vinyl surfaces.
Wow.
Yeah, cause cracking of the upholstery on the chair, or the laminates even that are used for the orthodontic side unit, and it's
Hmm.
corrosive. Just
Oh,
imagine if you were wiping the air water syringe, all the connectors for the handpieces, you could get corrosion over just a week or two period of time of using that bleach substitute.
okay.
So whichever product they're using, if they do go to creating their own container, not only do they need to label it with the name of their product, but they're going to have to go back to that safety data sheet from the manufacturer and create an OSHA secondary chemical hazard label. And
Okay.
that's going to have the safety precautions, identify the product. So they have to have that globally harmonized secondary chemical hazard label on any other container other than the manufacturer's container that you're using. So it's difficult, to change products and looking at using a new product.
Yeah.
They have to clean the surfaces, remove any residual chemicals that are there from the former disinfectant, because
Hmm.
if they mix those, it can have adverse effects.
Oh, okay.
And
Well, that's great.
yeah, it can turn a bright orange or yellow, change colors, which you don't want that staining.
Right.
And it could inactivate the chemicals,
Mm.
or it could produce toxic fumes or bad smells from it.
So you
So
really
change.
don't want to switch cleaners in the middle of your cleaning process, basically.
No, no. Just because you go, oh, well, the brand we've been using is no longer available. We can't get Optum One right now, so we're going to change to the XYZ brand.
Mhm.
You have to look, what is the chemistry of it? Clean all of the residual disinfectant off by washing the surfaces with soap and water, and then decide, and read the label closely to
Mhm.
know what is your wet contact time with it,
Okay.
and then appropriately provide the training, for the rest of the team, so that they don't just continue to use the new product the way that they did the old product.
Okay. Is there anything special kind of soap they should be using, or is there any consideration that needs to go into that?
Not really. I often recommend Dawn dish detergent. We all know that it's got great grease cutting ability, and that phenol is an oil based with it.
Mhm.
So just washing down everything with a dish detergent. I would say a regular dish detergent, not one that has added chemicals for skin softeners or other products in it. Just a basic dish detergent. Yes.
Okay, great. Well, I think this is some great information for our viewers. So thank you, Jackie.
You're welcome, Allison. It is a challenging time. We keep running into these new challenges with it. And who knows what we'll be talking about next week.
Very true. It's been interesting.
Yes.
Well, we will be back next week for the next episode of In the Sterilization Room with Jackie. In the meantime, be sure to keep up on the latest orthodontic industry news, or check out past episodes of In the Sterilization Room at orthodonticproductsonline.com. Until next time, take care and stay safe.